I'm Dr. Burkich. I'm originally from upstate New York. Presently, my practice is in North Georgia, in Ringgold, which is just outside of Chattanooga, and in Atlanta, Georgia. We're really trying to improve the quality of people's lives. We do a lot of bioidentical hormone replacement therapy. We do a lot of IV therapies, a lot of chelation therapy. We've really been doing the IV therapies, including chelation therapy and anti-inflammatory IV therapies, as well as the bioidentical hormone replacement therapy for about 15 years. So really when it comes to something like a fellowship in anti-aging and regenerative medicine, I think it's sort of brushing up on some finer points. You know, every year I think in medicine it's reasonable to say that we learn how little we know. And that's really encouraging because it makes it something interesting every day. So I think the fellowship is really a good thing for sharpening your skills and keeping on top of things, so to speak. I really do believe that heavy metal toxicity is at the root of a lot of health problems. Hormone-producing cells are very sensitive to heavy metals, and if you're going to affect hormone-producing cells adversely, then obviously your hormone production is going to go down, and from that you're going to have all kinds of bad things happen. You know, you lose your muscle mass, you lose your reservoir to dump blood glucose into. You tend to leave your blood glucose levels higher longer, which means your insulin levels are higher longer. So many of these degenerative things that happen, I think, can be attributed to heavy metal toxicity. The chelation therapy has worked very well. You know, one of the nice things is that I can say to any of my patients, I've had over 100 chelation treatments myself, so I don't recommend for other people what I wouldn't do for myself. The proof is in the results that you see. We really started out with things like diabetes, with peripheral vascular disease, coronary artery disease, things that you would sort of associate with age. And with time, I think what's happened is, for example, when we started doing testosterone replacement therapy on our coronary artery disease patients, we started noticing, and everybody started noticing, how much better they looked. And when you look good on the outside, you look good on the inside. And that kind of spawned our bariatric practice in terms of our diet program, where we help people take off body fat. If you don't have enough testosterone, for example, you don't feel like exercising, you don't sleep very well, you can't really do much of anything, and you're in a bad mood most of the time. So when you fix that, then I think patients are in a much better position to do the lifestyle changes on their own. Again, when you fix a number of these different things, you'll see things like chronic fatigue, fibromyalgia all improve. I think it's important to get to the root of the problem. We've developed all these different specialties that address all these individual problems that may all be tied to one underlying problem or a series of underlying problems. And that's why they say, you know, the #1 industry in this country is healthcare. It's become big business keeping people sick. So our goal, again, is to not hurt people, but secondly, to get results for people. And that's all centered around getting to the root of the problem. And then what you'll notice is all these other problems incidentally get better. You know, when we do chelation therapy on somebody, I don't say, hey, we're going to fix your sinus or your chronic sinus problems. But it's amazing how many patients will say, hey, since I've been getting the chelation therapy for my heavy metal toxicity and it's been improving my peripheral vascular disease, it's interesting that my sinus infections have gone away. So many of these problems have an underlying root that if you address the core of the problem, a bunch of different things will improve. If you'd like more information on our practice, please feel free to contact us at Preventive Medicine, Anti-Aging, and Chelation. We'd be happy to help you.